Professor Emeritus, Department of Cell Cancer, esteemed here Udupi to take over the session. Welcome, sir.
अथा तो नेत्रबस्ति प्रमाण प्रविभाग चिकित्सितं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः about the Basti. Now about the Basti, the details given in Sudha are comparatively lesser, whereas you have more details in Charaka Samhita. But we will limit to whatever Sudha has mentioned, we will not go beyond that. तत्र स्नेहादीनां कर्मणां बस्तिकर्म प्रधानतमम् आहुः आचार्याः कस्मात् अनेक कर्मकरत्वात् बस्तेः इह खलु बस्तिः नानाविधद्रव्यसंयोगात् दोषाणां संशोधन संशमन संग्रहणानि करोति क्षीणशुक्रं वाजीकरोति कृशं ब्रह्मयति स्थूलं कर्षयति चक्षुः प्रीणयति वलीपलितम् अपहन्ति वयः स्थापयति शरीर उपजयं वर्णं बलम् आरोग्यम् आयुषः कुरुते परिवृद्धिं च बस्तिः सम्यक् उपासितः. Among all the snehana karma, basti karma is considered as the most important because it can do various forms of the functions, and as the basti can be given with the different varieties of the medicines, it can act as a shodhana, shamana or sangrahana, that's a reduction of the secretions, or it can enhance the sexual power, it can add to the body weight, or it can reduce the body weight, it can help in improving the vision, it reduces the effect of aging as such, and it can help in better health as such. Tatha, it's not only that much, the other diseases also can be cured with the basti, and those are jwara, atisara, timira, pratishaya, shiroroga, adhimanta, ardita, akshepaka, pakshaghata, ekanga, sarvanga roga, atmana, udara, yonishula, sharkarashula, वृद्धि उपदंश आनाह मूत्रकृत्स गुल्म वातशोणित वातमूत्रपुरीश उदावर्त शुक्रार्तवः शुक्रार्तवस्तन्यनाश हृत् हनुमन्याग्रह शर्करा शर्करा अश्मरी मूढगर्भप्रदेश च अत्यर्थम् उपयुज्यते. It can be used in treatment of many of these disorders, a huge number of disorders, almost all disorders. Basti can be administered. भवति जात्रा बस्तिर्वाते च पित्ते च कफे रक्ते च शस्यते संसर्गे सन्निपाते च बस्तिरेव हितस्सदा. Basti can be given in any of the dosha conditions and in any of the status, like whether there is a combination of the dosha or a single dosha, Basti can be administered in all such conditions. तत्र सांवत्सरिक द्विः अष्टवर्षाणां षडष्ट दश अङ्गुलप्रमाणानि कनिष्ठिका अनामिका मध्यमङ्गुलिपरिमाणानि अग्रे अध्यर्थांगुल द्व्यंगुल अर्धतृतीय अंगुल सन्निविष्ट कर्णिकानि कंक श्येन बर्षिण पक्ष नाड़ी तुल्य प्रवेशानि मुद्ग माशक कलाय मात्र स्रोतांसि विदद्यात नेत्राणि. In administration of the basti, one of the most important instrument is the basti netra, the tube through which the drug has to be passed into the rectum, and it can be the size of that would be changed according to the age of the person. If the child is a 1 year child, then the width of the treatment, that tube would be as that of the little finger. And in Ashtavarsha, 8 years, then it becomes a anamika, that the middle finger dimension. Anamika is the second finger dimension. Then Dvidashavarsha, that's 16 years, it becomes a middle finger as such. Then Shadashta, that's up to 64 years, is a madhyam anguli pramana. The thumb size would be the dimension of the tube through which the basti has to be administered. So the important is the dimension of the tube through which you have to insert administer the basti would be custom made according to the size of the body and age of the person. That's the important thing. And the tube has to have 3 layers of some circular structures so that it doesn't really enter beyond that limit. And those circular structures would be at 1.5 angulas, at 2 angulas and 3 angulas. There will be a karnika, circular ring-like structure added to the tube so that it doesn't enter beyond that limit. Then the external opening, that's the opening through which the drug has to be passed through, would be as thick as Kanka, Shena, Barshi, Pakshanadi Tulyani, as wider as that of either Kanka bird. Kanka bird itself is a confusing issue now, so we don't know. Shena is eagle, then Barshi Pakshi is another wide winged bird as such. Again, according to the age of the person, the size of the tube opening through which the tube has to be passed through would be decided, as well as the lumen of the tube would be Mugga Masha Kalaya Matra Sotamsi, as with as a Mugga green gram or Masha black gram or Kalaya, the Satinadanya. These are the dimensions of the lumen of the tube through which the Basti has to be given, and most important is the Basti Pramana, Dravya. It would be Atura Hasta Sammitena Prasrutena. Prasruta is the size or quantity of the substance which can be held by the open hand of the person, slightly folded hands of the person. That's a Prasruta, and it could be Dvau Prasruta, 2 Prasruta, or Chatvari, 4 Prasruta, or 8 Prasruta, depending upon the age of the person. वर्षांतरेषु नेत्राणां वस्यमानस्य चैव हि वयोबलशरीराणि समीक्ष उत्कर्षयेद्विधिं पञ्चविंशतेः ऊर्ध्वं 12 अङ्गुलं मूले अङ्गुष्ठोदरपरिणाहम् अग्रे कनिष्ठिकोदरपरिणाहम् अग्रे त्र्यङ्गुलसन्निविष्टकर्णिकं गृध्रपक्षनाडीतुल्यप्रवेशं कोलास्थिमात्रछिद्रं क्लिन्नकलायमात्रछिद्रम् इत्येके सर्वाणि मूले बस्तिनिबन्धनार्थं द्विकर्णिकानि आस्थापनद्रव्यप्रमाणं तु विहितं 12 प्रसृताः सप्ततेस्तु ऊर्ध्वं नेत्रप्रमाणम् एतदेव द्रव्यप्रमाणं तु 2 अष्टवर्षवत्. Now the size of the Basti tube has to be changed according to the age and the strength of the person, and there was a difference of opinion about the dimensions. Whatever we have discussed till now is what's mentioned by Sushruta. And in Sushruta period there was a difference of opinion among the practitioners about the size, and according to some, after 25 years it would be 12 angula. 12 angulas would be the dimension length of the tube, and the Mula Angustodar Parinaham, at the base it will be as that of the thumb, and in the tip it is as thick, as thin as the little finger, and there will be at the 3 angular level. After 3 angular there will be Karnika, or that ring like structure, and the tube lumen would be as that of Gridhapaksha Nadi, the lumen of the eagle as such. Opening would be as thick as a colasti. This is one of the opinion at that time which was existing. So there was a difference of opinion according in Sushruta's period. Then the quantity of the drug in general can be mentioned as a Dvadasha Prasada, 12 Prasadas also. See, at one opinion there will be variation according to the patient's condition, like Viprasada, Chatuh Prasada, or 2 Prasadas, 4 Prasadas, or 12 Prasadas, and after 70 years it should be same quantity, that's Dvadasha Prasada, and Netra Pramana has to be given. Now, as far as the Basti instrument is concerned, the original Basti instrument mentioned in Samhitas would be bladder of dead animals, which would be connected to a tube. But in the present day situation, now this kind of a structure, a balloon, rubber balloon, may be used as a tube, connected to a tube can be used as the conventional Basti. And the Karanikas which are mentioned, like which can help in tying this balloon to the tube, would be of different 3 levels, and then of course the tube could be given. But in the present day situation, we do use lots of other variable instruments. The safest now is the gravitational force, where the drug is administered through the gravitational force. Variation of these structures would vary the pressure of the flow and the level to which the Basti Dravya would be reaching to, and hence I would not comment much on these issues like which of the instrument is better. But as far as the safety point of view is concerned, the gravitational force used instrument, that a pot and a tube where you raise the pot so that the flow would occur, and the flow rate can be controlled by increasing or reducing the level of the pot as such would be always safer than any of the other tools as such. Of course, other tools would have some benefits, some disadvantages, and so on. Then mruduh bastihi prayuktavyaha visheshat balavruddhayoh tayoh tikshna prayuktastu basti himshad balavishi. Whenever you give a basti dravya, it should be mrudu for either old age or young age people. Tikshna basti should not be given in such people because it can hurt them. Vrananetrам astambulam mugdavahi srotah vranam aveksha yathatsum sneha kashaya vidajita. Now there is another variation of the basti considered by Sushruta like Rana Basti. Rana Basti is a different issue, where again a similar instrument is used, a balloon-like instrument connected to tube is used, and that doesn't come under the general Basti Chikitsa as such. This is a very specific tool used for treatment of the wound, and Sushruta refers to that in this context as the dimension of that would be as that of a green gram, Mudgavahi Srotaha, and the Dravya Kashayas, it could be according to the patient's condition. Tatra netrani suvarna rajata tamra ayo riti danda shrunga mani tarusaramayani shlakshani dridhani bhugchakratani rajini gutika mkhani. The tubes could be prepared out of gold, silver or copper or iron, or could be the ivory or maybe horns of animals or any other crystals or wooden tube materials could be used, but they should be smooth and strong enough, and the shape should be, the tip should be narrow and the base should be wider as such. Bastayasya panthyaha mrudavo natibahalaha dradaha pramanavantaha gomehishavaraha adyo urabhranam netralabhe hitanadi nalavamshasya sambhava bastyalabhe hitam charma suksham vatantavam khanam. Now Basti, the original Basti is a bladder of dead animals, and it could be any of the animals like go, mahisha, varaha, either a cow or a buffalo or even the pigs and so on. There are different sorts of the animals could be used. Bladder of the different animals could be used, which is processed, dried and processed, which is soft as such. Suppose you do not get the proper Basti nadi and the Basti, Sushruta suggests you may use a bamboo stick as the tube, and any thick leather or thin leather which is having that consistency can be used as a Basti as such. Bastim nirupadigdham tu shuddham suparimarjidam mrudu anudhatahinam muhu sneha vimarjidam netramule pratisthapya nibdyam tu vyurtanam badbha lohena saptena charma srotasi nirdaheta परिवर्त्यतो बस्तिं बद्ध्वा उत्तम निधापयेत आस्थापनं च तैलं यथावत्तेन दापयेत. The leather, that the bladder of the animal has to be processed with the, of course it has to be cleaned first, and then it has to be processed by applying some oily substance over that, and it should be tied to the tube, tied firmly, and it may be with a metal wire, and it should be kept sterilized by heating and kept ready for the administration of the Basti. Tatra Vivido Bastihi Nairuhikaha Snehikascha. According to Sushruta, the Basti are classically classified into two, Niruha Basti and Sneha Basti. Of course, they could be further differentiated, and that details are more in Charaka Samhita as I said, but I will not go into that now at this context. Astapanam Niruha iti anasthapiparam. Astrapan Basti and Niruha Basti are the same, they are synonyms. Tasya Vikalpaha Madhupedikaha. One variation of that would be Madhupedika Basti. Now this again is a Sushruta's version. There is a slight difference of opinion about these issues in Charaka Samhita as such. Tasya Paryaya Shabdaha Yapanaha Yuktaradhaha Siddhabasti. The Madhupedika Basti also is named as Yapana Basti, Yuktaradha Basti or Siddha Basti. Sadosha Nirharanat Sharira Nirohana va Niruhaha, because it removes the doshas or it can help in drying up of the contents of the body. It's called as Niruha Basti. Vayastapanat Aistapanat Astapanam, because it establishes the age of the person or stabilizes the age of the person or stabilizes the body of the person. It is called as Astapana. Mahatailika Vidanam to Niruha Upakrama Chikitsa Vakshamaha. In the Niruha Upakrama Chikitsa, the Mahatailika Basti is mentioned in detail as such. यथा प्रमाण गुणविधः स्नेहबस्ति विकल्पो अनुवासनः पादावकृष्टः 1/4 of the basti given in with the taila dravya, some oily substance, is the sneha basti. Anuvasanapi nadushyati anudivasam adiyate iti anuvasanah. Anuvasana basti is considered as a named as anuvasana because even if it is left over for a day in the rectum, doesn't harm. It may not be expelled immediately, and hence it is called as anuvasana. तस्यापि विकल्पो अर्धार्थ मात्रा अवकृष्टो अपरिहार्य मात्रा बस्तिः. When the quantity of Dhanvasana Basti is reduced to half or still 1/4 of that, that's called as Matra Basti. Niruha, Shodhan, Lekhi, Snehiko, Brahmanomarah. Niruha Basti is for Lekhana, Shodhana, or Snehika or Brahmana. Any of the purpose can be achieved in the Niruha Basti by varying the contents. Now, as far as the nomenclatures of these and definitions of these are concerned, there is a slight variation between Charaka and Sushruta, but whatever we are discussing is of Sushruta. Niruha Shodhitan Margan, Samyak Sneho Anugachati, Apeta Sarvadoshasu, Nadi Shiva Vahajadam, Sarvadosha Raschaso, Sharirasya Jijivanaha, Tasman Vishuddha Dehasya Sneha Bastir Vidhiyate. Sneha Basti is always preferred to be given after the Niruha Basti. This again is a Sushruta version. In practice, we generally do not do that. We start with the Sneha Basti and then the Niruha Basti is given. In Sharangadhara or in Charaka, this kind of issue is stressed as such. Sushruta says a slightly different version. You have to give Niruha Basti initially, then the Sneha Basti has to be given, because after giving the Niruha Basti, the total lumen will be cleared and hence the passage of the substances will be facilitated. Of course, this kind of a difference of opinion is again, there is a bit of controversy issue. In the later chapters, Sushruta also says that Sneha Basti has to be given before the Niruha Basti. So, whether Niruha Basti has to be followed by Snehana or that controversy is not an issue. Practically, we do not give any Niruha Basti without Sneha Basti given earlier. At least one or two of the Sneha Basti is given, then the Niruha Basti is given, then only the patient can tolerate that Niruha Basti better. तत्र उन्माद भय शोक पिपासा अरोचक जीर्ण अर्ष पांडुरोग भ्रम मद मूर्छा छर्दि कुष्ठ मेह उदर स्थौल्य श्वासकास कंठशोष शोफ उपसृष्ट क्षत क्षीण शोपोपसृष्ट क्षत क्षीण चतुस्त्रिमास गर्भिणी दुर्बलाग्नि असहा बालवृद्धौ च वातरोगाग्रते क्षीणाः न अनुवासव्याः न स्थापितव्याः. Anuvasana and Astapana is contraindicated in these conditions, particularly, very specifically, based upon my clinical experience. Shophopasas, those who have edema, the Basti is better not to be given. And the first 3 months of pregnancy, Chaturstri, either 3 or 4 months of pregnancy, this Basti is contraindicated very specifically. In addition to that, Sushruta has mentioned a list of the diseases where Basti is contraindicated. Udari cha pramehi cha kusti sthulascha manamah avashyam sabanyasya na anuvasyaha katanjana. In udara prameha kusta, it has to be only astapana Basti, not anuvasana Basti to be given. Again, this also is the issue. Whenever we give Basti, we always give a package that the Kala Basti, Karma Basti, Yoga, which I mentioned in Charaka Samhita and the later texts as such, that Anuvasana has to be a part of it. But giving Anuvasana alone may not be a optimum thing in case of Dudara Prameha Kushta, whereas Asapana has to be given. Asadhyata Vikaranam Syat Esham Anvasanat, Asadhyatvepi Bhujistam Gatranam Sadanam Bhavet. By giving Anvasana alone, in such conditions, the diseases may become incurable and it also can harm the body. Pakvashe tatha shroonyam nabhi adhasthacha sarvadaha samyak pranito basti sthaneshu eteshu tishtari. Pakvashayat basti viryam kheihi deham anusarpadi vriksham mule nishiktanam apam viryam ivadruvam. The basti given into the pakvashaya, that's the rectal area, would spread into the whole of the body like the water spreading into the whole of the tree through the roots. Given water poured at the roots spreads into the whole of the tree. Similarly, it spreads through as such, though the drug remains at that area. Now, as far as the functionality of the Basti is concerned, there are a lot of difference of opinion. There are many experiments also are done, many people and There is no conclusive version. From the current science point of view, there is one new idea like the gut-brain axis. The whatever the functions of the brain and nervous system are concerned, they are dependent upon the gut condition, the microbia of the gut, and it's a very new concept coming to in the contemporary science. But its therapeutic utility and the modifications are not really used. Basti may be one of such tools by which we can strengthen that gut brain axis or modify the gut brain axis. That's one of the possible theory which I can just present as a सचापि सहसा बस्ति केवल समलोपि वा प्रत्येति वीर्यं तु अनिलैः अपानाद्यैः विनीयते. After giving Basti, it may come out either immediately along with the feces, or it may remain there in the body, can produce its beneficial effects. वीरेण बस्तिः आदत्ते दोषान् आपादमस्तकात् पक्वाशयस्थो अम्बरगो भूमेः अर्कोरसानिम स कटीपृष्ठकोष्ठस्थान् वीर्येण आलोड्य सञ्चयान् उत्खातमूलान् हरति दोषाणां साधुयोजितः. The Basti given, depending upon the drug as such, it can extract the doshas, vitiated elements from the body, from all over the body, and similarly given is like the sun extracting or drying up the water content throughout the earth. Similarly, the drug given can spread into the whole of the body, and because of its functionality, it can remove all the vitiated elements from the body and expel it out. दोषत्रयस्य यस्माच्च प्रकोपे वायुः ईश्वरः तस्मात् तस्य अतिवृद्धस्य शरीरम् अभिनिघ्नतः वायोः विशते वेगं नान्या बस्ते प्रतिक्रिया पवन आविद्धतो यस्य वेलाः वेगम् इव उदुदेः शरीरोपजयं वर्णं बलम् आरोग्यम् आयुषः कुरुते परिवृद्धिं च बस्तिः सम्यक् उपासितः. A properly given Basti would control the Vata dosha, because Vata dosha is the most important dosha. And Sushri gives a simile like the sea having its waves related to the air there, and if the air is controlled, the waves in the sea can be also controlled. Similarly, by controlling or modifying the functions of Vata, all the diseases can be cured, and it can help in better health condition as such. अतः ऊर्ध्वं व्यापदो वक्ष्यामः. The व्यापद or complications of the Basti are mentioned further, and they are तत्र नेत्रं विचलितं विवर्तितं पार्श्व अवपीडितम् अत्युत्क्षिप्तम् अवसन्नं थिर्यप्रक्षिप्तम् इति षट् प्रणिधानदोषाः. The complications can be produced could be categorized into many categories, and one set of that, six of them could be due to the technique of administration, like the bastinetra, the tube, if it is not kept properly, or if it moves during the administration, if it is rotated, if it is pressing on one side, or if it is pushed too hard, too much as such, or if it is not really getting into the rectum properly, or if it is given wrongly, create a passage. These are the different pranidhana dosha, administration as such. Then errors of administration. The atispulam karkasham amanatam anu bhinnam sannikrishya viprakrishya karnikam sukshmatidram atidirgam atihrasvam astimat ityekadasha netradoshaha. The 11 these defects of the tube which you use for the administration could be either too thick, too thin, or broken, and so on. Then bahalata, alpata, satchidrata, prastirnata, durbadhrata teti pancha basti doshaha. The basti, that bladder which is tied to the tube. Now this is important in social spirit. Now of course we may not have that kind of issue. If it could be either due to very wide tube, or maybe if it is not tied properly, or if it is compressed too hard, or if it is compressed less than optimum, or instead of a single push, if it is pushed very slowly repeatedly, or if it is delayed, then these are the pidana dosha, compression abnormalities, or similarly their basti material also could be defective. Then amata, heenata, atimatrata, atishitata, atyushnata, atitikšnata, atimrutata, atisniptata, atirukshata, atisandata, atidravati, ekadasha dravya doshaha. There could be defects produced due to the substance which you have given, which could be due to improper preparation, quantity, or warmth of these which could be bearing as such. Then avakshirsha, utshirsha, nyubja, uttana, sankuchita deha, dehasthita, dakshina parshashayanaha, pradhanamiti, saptashaya doshaha. There could be errors produced due to improper positioning of the patient, and one of the important issues it has to be given when the patient is lying down on the left side. Anatomy of the rectum suggests about that. If it is not proper, if it is given on the right side, and then if the head level, head end is lower, or if the neck is bent forwards, or the body is flexed too much, in that condition, there could be errors, and these are 7. एवमेताः चतुश्चत्वारिंशत् व्यापकव्याधिनिमित्ताः वैद्यनिमित्ताः. These 44 are the defects which could be produced due to the techniques of administration and physician's prescription. Then athara nimittah, there are the possible effects, harmful effects of the Basti could occur due to the patient's asset, and those are 15. Atharobhadrava chikitsire ukshante. That would be discussed in atharobhadrava chikitsa. स्नेहस्तु अष्टमिक कारणैः प्रतिहितो न प्रत्यागच्छति चतुर्दोषैः अशनाद्भूतः मलव्यामिश्रः दूरानुप्रविष्टः अश्विनस्य अनुष्टः अल्पभुक्तवतः अल्पश्चेति वैद्यातुरनिमित्ताः भवन्ति. The Basti Dravya given would not be expelled out, it may remain in the body due to either consumption of the food, or if it is mixed with the feces, or if it is pushed too hard and then it has gone much more proximally. If the swearing is not done, if there is no warmth, or if the quantity of the food given is not enough, or quantity of the drug also is not enough. अयोगस्तुभयोः आत्मानं परिकर्तिका परिश्रावः प्रवाहिका हृदयोपसरणम् अङ्गप्रग्रहः अतियोगो जीवादानमिति नव व्यापदः वैद्यनिमित्ताः भवन्ति. The other complications which can occur could be vegetation, which is related to the technique of administration, is ayoga, atiyoga, atmana, parikartika, parisrava, etc. Injury at the area as such. बहुत जाता षट्सप्ततिः समासेन व्यापदपरिकीर्तिताः तासां मोक्षां विज्ञानं सिद्धिं च तदनन्तरं. The 64 varieties of the possible complications can occur, and they are to be discussed in the next chapter. So next chapter is athato netrabastivyapat chikitsam vyakhyasyaमः तोवाच भगवन्तरन्तरी. We will consider the same defects in detail in the present chapter. अथ नेत्रे विचलिते तथा चैव विवर्तिते उदे क्षतं रुजावा स्यात् तत्र सद्यक्षतक्रियाः. If during the administration, if the tube is moving, or if it is not properly, there could be an injury to the anal opening, and that the treatment will be as you treat any other wound. अतिक्षिप्ते अवसन्ने च नेत्रे पायो भवेद् रुजाः विधिरत्रापि पित्तघ्नः कार्यस्नेहेश्य सेचनम्. If it is tube pushed very hard, or if it is not placed properly, that again there could be inflammation, and that the treatment has to be pittahara chikitsa, and local application of oily substances could be given. तिर्यक् प्रणीते नेत्रे तथा पार्श्वापीडिते मुखस्य आवरणात् बस्तिः न सम्यक् प्रतिपद्यते. If the tube is not mentioned straight, if it is kept in oblique condition, or if it is placed in a different area, the drug will not reach to the rectum, and hence there will be failure of the effects as such. Rujunetram vidhyayam syat tatra samyak vijanata, and hence the tube has to be kept straight. Atistule karkashe cha netre netre astim adigarshanat gude bhave kshatam mrutya sadhanam tasya purvata. If the dimensions of the tube are not proper, or if they are pushed very hard, then there could be injury, and the treatment is as earlier. आसन्न कर्णिके नेत्रे भिन्ने अणुवापि अपार्थकः अवसेको भवेत् बस्ते तस्मात् दोषान् विवर्जयेत्. If the tube is tied very closely, the bladder is tied very close to the tube, then there could be leakage of the drug, and hence there could be problems that your expected effects may not occur. प्रकर्ष कर्णिके रक्तं गुदमर्म प्रपीडनात् क्षरयत्य अत्रापि पित्तघ्नः विधि बस्तिश्च पिच्छिलः. If the karnika, that circular structures of the tube, has gone into the rectum, then there again there will be injury, and the treatment has to be as we treat any other injury, and pichila basti can be given. हृस्वेतु अणुस्रोतस्य च क्लेशो बस्तिश्च पूर्ववत् प्रत्यागच्छन् ततः कुर्याद् रोगान् बस्ति विघातजान् दीर्घे महास्रोतस्य ज्ञेयम् अत्यवपीडवत्. If the dimensions of the tube are less than optimum, the drug will not pass through. If the dimension is more than what's optimum, then there could be a very fast drug getting into the body. And if the pressure also, if the compression pressure also is more or lesser, the same effect would occur, and the expected benefits would not occur if it is not proper. प्रस्तीर्णे बहले चापि बस्तौ दुर्बद्धदोषवत् बस्तौ अल्पे अल्पतः वापि द्रव्यस्य अल्पाः गुणाः मताः दुर्बद्धे च अणुभिन्ने च विज्ञेयं भिन्ननेत्रवत्. If the basti is not tied properly, or that bladder structure, that balloon like structure is not of optimum consistency, either it is very thin or very thick, or if it is perforated, there would be leakage of the drug and the benefits would not occur as such. अतिप्रपीडितो बस्तिः प्रत्यापि आमाशयं ततः वातेरितो नासिकाभ्यां मुखतो वा प्रपद्यते. If you press very hard, it will reach up to the stomach, or even it may come through the nose or the mouth. Of course, practically to come to that level, I think you will have to push so hard, which may not be so practically seen. And I would consider that if at all you have pushed so much as the drug has to come through the mouth, before it reaches the mouth, it would perforate the intestine somewhere, and hence there could be very serious complications. So practically, you may not see that kind of a complication now. तत्र चूर्णं गलापीडं कुर्याचापि अवज्गुणनं शिरक्काय विरेकोचित तीक्ष्णो सेकांश शीतलान. In such conditions, immediately you have to compress the neck, and then you have to remove all that substances which have come out, and Shiro Vilechana has to be given, and Shita Sheka has to be given. शनै प्रपीडितो बस्ति पक्वाधानं न गच्छति न च सम्पादयत्यर्थं तस्मात् युक्तं प्रपीडयेत्. If it is not pressed properly, if the compression is not enough, the drug will not reach to the optimum area, and hence the benefits would not occur. Then bhuyo bhuyo avapidena vair antaprapidhyate tena atmanam bhujashchokra yatha swan tatra bastayah. Due to repeated compression, air will be pushed in, and that results in distension. Of course, when you use a gravitational force container, as we use now, these kind of complications do not occur. कालातिक्रमणात् क्लेशः व्याधिश्च अभिप्रवर्तते तत्र व्याधिपलग्नं तु भूयो बस्तिं निधापयेत्. If it is not given in proper timing, if it is too much delayed, then you may not have the same benefits, and there you have to follow the proper technology later. बुधोभदेह शोफौतु स्नेहो अपक्व करोति हि तथा संशोधनो बस्ति हितं चापि विलेचनम्. If the sneha basti given is not processed properly, that sneha dravya is not processed properly, it can stick on to the rectum, and the swelling also can occur, and there you have to give a samshodhana basti later and vilechana. Hira matra ubhau basti nati karyakaro matau अति मात्रौ तथा आनाह क्लम अतिसारकारकौ मूर्छां दाहम् अतिसारं पित्तं च अत्युष्णतीक्ष्णकौ मृदु शीतौ उभौ वात विबन्ध आध्मानकारकौ तत्र हीनादिषु हितः प्रत्यनीकक्रियाविधिः बुधबस्ति उपदेहं च कुर्यात्. If the quantity of the drug given is not proper, or if the consistency of the drug is not proper, or administration is not proper, technique is not proper, in all that, which there could be Ati Yoga or Hina Yoga. In these conditions, the patient may have Daha, Murcha, Atisara, or Pitta Vruddhi can occur, and hence in such, or Vata Vibandha or Admana also can occur. In such conditions, you have to give again a proper course of the basti. बुधबस्ति उपदेहं तु कुर्यात् सान्द्रो निरोहणः प्रवाहिकां च जनयेत् तनुः अल्पगुणावहः तत्र सान्द्रे तनुं बस्तिं तनौ सान्द्रं च दापयेत्. स्निग्धो अतिजाड्यकृत् रुक्षः स्तम्भाग्नकृत् उच्यते बस्तिं रुक्षम् अतिस्निग्धे स्निग्धं रुक्षे च दापयेत्. If the consistency of the basti dravya is too thick, it can result in pravahika, that leakage contents. Or if it is too thin, then again it can will not produce the same benefit. So that you have to modify the consistency and administer the drug with the proper consistency. If it is too much oily, the contents of oily contents are too much, then it can result in lethargy after the administration. If it is too dry, oil is lesser, then it can produce distension of the abdomen, and hence the oil content of the basti has to be regulated properly. अतिपीडितवद् दोषान् विद्धि च अपि अवशीर्षके उत्शीर्षके समुन्नाहं बस्तिं कुर्याच्च मे हनम्. the positioning of the patient, like if the head end is lower, then it will be producing the same complications of Atipitta, that it may go more proximally than what is expected. Or Uchishak, if the head end is raised, then it may not get reach to the area and produce dissection. Tatra uttaro bastihi hitaha susinnasya sukavaha. In such conditions, you have to give uttara basti. If the patient is bent for too much, nibdasya, if the patient's body is curved, then basti napnoti pakvadhanam vimargaha hridgudam bhagate tatra vayu kostamatapiva uttanasya avarse marge bastihi now if the patient's positioning is not proper, then again it can produce the complications of pain in the chest or rectum, and there again you have to take care in that position. Uttanasya avarse marge, if the patient is lying down straight and then the anus is closed, then basti antaprapadyate. Netra samvedana bhranto vayuscha antarprakupyati. Due to that netra, the tube which is inserted, the patient may become restless and he moves around. Then again there could be air getting into the bladder, into the rectum, and it also can produce a harmful effects. Dehe sankutite dattaha saknoha api ubhayoh sada na samyak anilavishtaha basti pratyeti dehinaha. If the body is too much flexed, then again it may not enter in, and it may not even flow out easily. Sthitasya basti tattastu क्षिप्रम आयाति अवामुखः न च आशयं तर्पयति तस्मान् नार्थकरो हि सः. If you give basti in a standing position, that again it will not reach to the area and it will not produce the same issue. Of course, practically these are not very significant issues, so because we generally would not do that. नाप्नोति बस्तिः तत्तस्तु कृष्णं पक्वाशयं पुनः दक्षिणाश्चिरपार्श्वस्य वामपार्श्वानुगयतः. If the person is lying down on right side and then if you give the basti, it will not reach the area. This again based upon the anatomy. Nibdadinam pradhanam tu baste naiva prashaste pashchat anila kopotra yatha swam tatra karayet. If the positioning is not proper, it can produce vata prakopa, and then you will have to treat them as the vata prakopa. Vyapadaha sneha baste sukshante tachikisade. More of the vyapat would be given in the other chapter. Ayogadhyastu yascha vakshami vyapadah sachikisidaha anusno alpaushado hino bastihi naiti prayojitaha. The other complications produced due to the improper content of the drug, or even the warmth of the drug is not maintained properly, it can result in vishambha admana shulesha tamayogam pratyakshade. A basti ayoga will result in, that's improper, less than optimum basti would result in constipation, distension of the abdomen and pain. Tatra tikshna hisa bastihi tikshnam chapi virechana. In such conditions, another tikshna basti or a virechana can be given. Sasheshamne athava bhakte bahudoshe cha yojitaha atyashidasya atibahuhu bastihi mandosne evacha anusna lavana sneha hi atimatro athava punaha tata bahuparisham cha kshipram adnapayen naram. हृत्कटी पार्श्वपुष्टेषु शूलं तत्र अतिदारुणं तत्र तीक्ष्णतरो हितं चाप्यनवासनम्. A distension can occur due to either consumption of excess of the food prior to the basti, or the basti is not given in sufficient warmth, or the lavana, the salt content and sneha content of the basti are not optimum, or the quantity of the basti given is too much. If the feces are too much feces are left over in the rectum and then you give the basti, in all such conditions there can be abmana, distension and pain. This occurs quite frequently, and in such conditions the treatment is tikshna taro bastihi. Another tikshna basti has to be given and anuvasana has to be given. Ati tikshna ati lavanaha ruksho basti prayodita sapiktam kopayad vayum kuryarcha parikartika. A proctitis, inflammation can occur if the basti dravya is very tikshna or too much of salt content are there, or if it is not having sufficient sneha dravya, then it can aggravate the pitta and local inflammation can occur. Nabi basti gudam tatra chinativa ative dehinaha picha basti hitasya snehascha madhurihi shrataha. In such conditions of proctitis or parikartika, picha basti has to be given, or any other sneham dravya with madhura dravya has to be administered. Atyamna lavanaha tikshnaha parisravaya kalpade daurbalyam mangasadascha jayate tatra dehinaha parisrave tatah pittam daham sanjanayad gude picha basti hitas tatra basti kshira ghutena cha. Too much of either Amla Rasa or Lavana Rasa or Tikshna Basti can result in incontinence, leakage of the contents, and the patient may become weaker. And such conditions, again, Picha Basti is suggested. प्रवाहिका भवेत् तीक्ष्णात् निरूहात् सानुवासनात् सदा शूलं पृच्छेन कफासृग् उपवेश्यते पित्ताबस्तिहितस्तत्र पयसा चैव भोजनम् pravahika or dysentery like condition can occur if there is a tikshna basti given or along with the anuvasana, and it can produce burning sensation, and there could be a bleeding or mucus or blood stained stools can occur. There again picha basti is the treatment given. Sarpir madhurike siddham tailam chapyanavasanam or madhura siddha sarpi has to be given. Atitikshno niruho va savate chanuvasanaha हृदयस्य उपसर्गं कुरुते चाङ्गपीडां दोषे तत्र उजस्त्रास्ताः मदो मूर्छा अङ्गगौरवं सर्वदोषहरं बस्तिं शोधं तत्र दापयेत्. If there is too much of Tikshna Dravya given in a Niroha Basti, or then it can result in Hridayopasarana, improper functioning of the heart, cardiac distress could occur, and pain throughout the body could occur. There again, the patient may have even impaired consciousness, and in such conditions, again a Shodhana Basti has to be given. Rukshasya Bahuvatasya Tatha Dushaitasya Ja Bastihi Angagraham Kuryat Ruksho Mrudu Alpabheshidha Tatra Angasadaha Prastambha Jumbha Udvestana Vepikaha Parvabhedasya Tatreshtaha Sweda Abhyanjana Bastayaha. If the patient is having Rukshata, that's if the patient is not given Snehana prior to that, or if there is a very severe Vatavyadhi, or if he is not positioned properly, it can result in a pain in throughout the body, and angasara, improper functioning of the body can occur, or there could be yawning or distress in the abdomen. In such conditions, again, Sweda Abhyanjana Bastayaha, you have to give another Sweda, Abhyanga, or another Basti can be given. Atishta Tikshno Atibahu Datto Ati Swedidasya Alpadoshasya Bastihi Ati Yogaya Kalpade विरेचन अतियोगेन समानं तस्य लक्षणं पिच्छाबस्ति प्रयोगश्च शीतशुकावः अतियोगात् परं यत्र अतियोग is when it is given in excess or the quantity the drug is not proper, it can result in atiyoga, and the treatment would be as you treat virechana atiyoga, that laghu ahara and water, sufficient water has to be given, or picchabasti also has to be given. अतियोगात् परं यत्र जीवादानं विरिक्तवत् देयस्तत्र हितश्चाप्सु पिच्छाबस्ति सशोणितः नवयिता व्यापदौ यास्तु निरूहं प्रत्युपद् उदाहृताः स्नेहबस्तिष्वपि हिताः विज्ञेयाः कुशलैः यः इत्युक्ताः व्यापदस्य वा सलक्षणचिकित्साः विश्वजाततुला कार्यं यथेता न भवन्ति हि. The complications which can occur can also result in bleeding, jivadana, bleeding. There again, the treatment as in case of the jivadana upadrava of the virechana. At times you may have blood mixed basti also has to be given, picha basti with the blood has to be given, and these complications have to be avoided, and basti has to be given carefully. Pakshat vireko vantasya tataschapi nirodhanam sadyo nirodho anumasyasya saptaratra virechitaha. The gap between the two different protocols of the shodhana has to be Pakshat Vireka Vantasya. There should be at least 15 days gap between woman and the Virechana, and there should be a 15 days gap between Niruha and the Virechana. After Nirudha, Anuvasana can be given immediately, or Anuvasana can be given after 7 days of Virechana. This is about the time gap required in between the two varieties of the Shodhana. So instantaneous Shodhana or package Shodhana, that kind of a treatment is not the right thing which can produce harm as such. With this, we will conclude today. It is Susuk Samhita Tikitsasthane Netra Bastivyapat Tikitsam Nama Shatrimshodhyayaha. If there are any questions, we will try to answer, then wind up. Right, okay, there are no questions, we will close.